Well, the treatment of Hodgkin lymphoma, particularly Hodgkin lymphoma patients with advanced stage disease, which is stage 2B, 3 and 4, has evolved quite dramatically in the last 10 years, and mainly in two ways. First, the introduction of PET response adapted treatment, which has enabled us to treat patients individually, so one size doesn't fit all anymore. We adapt treatment to the individual patient's response, and according to that response, we escalate or de-escalate therapy in order to keep or even improve the efficacy while reducing particularly the long-term toxicity of treatment. And then the second improvement, which is just as important as more recent, that's the introduction of new drugs. First of all, brentuximab vedotin, which was approved now several years ago as a single agent for relapse disease. It's now being introduced in first and second line therapy as well. And also the even more novel PD-1 inhibitors, also called checkpoint inhibitors, which have also been approved in relapse refractory disease, and now there are studies ongoing which look at these agents in combination with chemotherapy in first line treatment. So for brentuximab vedotin, the main study is the ECHELON-1 study, which was published last year, which is a randomization between our standard of care chemotherapy, which is called ABVD, a relatively tolerable multi-agent regimen, versus an experimental arm, which essentially was the same with bleomycin replaced by brentuximab vedotin. And we spent some time looking at the differences in efficacy, which was superior for the experimental arm, but also the toxicity profile, which gives different challenges. You see more peripheral neuropathy, which is a well-known side effect of brentuximab vedotin. Also more neutropenic sepsis, which to some extent can be managed or even prohibited by the use of primary GCSF prophylaxis. But very importantly also the complete abolishment of bleomycin-induced lung toxicity, which particularly in the elderly patient is really a big problem when you treat advanced stage Hodgkin lymphoma. We looked at studies incorporating brentuximab vedotin in first-line therapy in other ways as well, particularly in elderly patients, combinations with drugs other than ABVD as well, and also, like I said, the combination of anti-PD-1 antibodies, mainly nivolumab, with multi-agent chemotherapy for the treatment of different populations of Hodgkin lymphoma patients with advanced stage disease.